Fracture of the diaphyseal portion of the humerus. Here is the diaphyseal or shaft of the humerus. These are the extra-articular fractures and requires mechanical alignment. These could be of two types: simple or closed fracture and open fracture. Simple or closed fractures are treated non-operatively with functional humeral bracing, and union occurs within the 12 weeks. Gravity provides traction on arm, and in conjunction with the humeral brace help to hold the alignment and allows early range of the motion of the elbow. Active shoulder abduction should be avoided until fracture union to prevent varus deformity, and shoulder movement must not be absent during the treatment, and so gravity assisted pendulum exercises are instituted. Open fractures are associated with the vascular injuries are managed operatively, and open reduction and internal fixation is done. Internal fixation could be done with the plate fixation. Plate fixation is the most common. Other procedures could be the intramedullary nailing and screw fixation. Radial nerve injury is the most common complication of the shaft fractures of the humerus, and other complications could be non-union and the malunion. Now, distal portion fractures of the humerus. These are the articular fractures, but these are the less common types. It could be of the four types: condylar, intercondylar, and T-shaped. If fracture occurs at the side, that is called condylar. Intercondylar between the two condyles and between two epicondyles, and T-shaped fractures and Y-shaped fractures. Here, if fracture occurs on either of the condyle, then it's called condylar fracture. If it is between the two condyles, it's called intercondylar fracture, and here is Y-shaped condylar fracture. Here is T-shaped fracture of the humerus distal portion, and this is the transverse fracture. Mechanism of injury is fall on the outstretched hand. Treatment is in undisplaced or minimally displaced fractures. Fractures are treated non-operatively. In displaced fractures, in the young patient, open induction internal fixation is done, and displaced fracture in elderly and osteoporotic patient, artificial joint replacement is done. In this picture, fracture of the shaft of the humerus is stabilized with the DCP, and this fracture is stabilized with the key nail. Here, intercondylar fracture is stabilized. Fixation is done with the plates. In Y-shaped fracture, here also fixation is done with the plates, and T-shaped fracture is also fixed with the plates, DCP, dynamic compression plate. These are the few conditions in which the internal fixation is necessary: if there is displaced intra-articular fracture, open fracture, multiple injuries, non-union and delayed union, and those fractures which don't held in acceptable position with the brace treatment.